We had a really good day today. Dr. Rita Kutsikovich completed her first CHROME GuidedSMILE case. She happened to take on a double arch and a double edentulous, and I think everything went really well today. What do you?
Everything went beautifully. Yeah, we did not even have to adjust the occlusion. Everything just every step of the way, the instructions, everything was excellent. We got excellent support from Road Dental Lab. Ellen is the best. It was a difficult case because the patient did not have a lot of bone, and we had to ungulate the distal implants at an angle, both maxilla and mandible, to increase the, to give us the room to distalize.
Some AP spread.
Yeah, to give us some AP spread. Patient left really happy, and it was amazing.
It was good.
I can't wait to do more of these.
We're going to do more, yeah.
Yeah.
This was a patient suffering with perio for a long time.
Yes,
And
it was full mouth extractions 4 months ago, and then we made her dentures, and then she could not even wear dentures at all because she has a shallow palate, so they wouldn't stay in no matter what. So she was pretty much not wearing any teeth for the last 5 months.
One of the reasons it went so well with the occlusion is because Dr. Rita made new dentures, new setup, really went through the normal toils of making a denture to get the bite right.
Yes.
And so everything really came together nicely.
Oh, it was amazing. If I did it, I do a lot of surgeries free-handed. I don't think this would have, for this particular patient, there is no way I could have done it free-handed because it was a complex patient with the sinuses and too low, so implants had to be where they had to be.
Right, lots of angles. There were 5 angles on 9 implants.
Yeah.
Yeah, all right.
And then planning it with Joe Ambrose was amazing too.
Right, a couple different plans.
Virtually, yeah, we were planning.
All right.
Thank you so much.
Thank you. It's a great day.
Thank you.